Male infertility doesn't start when you get married. Absolutely not, because for some men, they actually do have the signs in them right from puberty, but they are unaware of it. And for most couples, this is a part that nobody's looking at. Now, let me start by saying this. It's not every man that has infertility that is going to have obvious signs or symptoms written all over them. No, because for some persons, they could have or struggle with infertility and still look completely healthy. But the truth is that there are certain, like patterns, or there are certain signs that the body will show you over time that most people ignore, especially for men. And that's why you realize that when people are married and pregnancy is not coming forth, immediately all eyes turn to the woman, and the woman can carry out tests. She can put herself under unnecessary pressure and be thinking, not knowing that it is also very possible for the man to be a contributory factor to the reason why they do not have kids yet. So in this video, I'm going to walk you through some signs or symptoms of infertility that can show up in a man right from a very young age. And I'm not doing this video for you to start panicking or for you to start pointing fingers or blaming one another. No, I just want you to be aware, okay, and take the right step, because sometimes what you don't know is actually what is even causing your delay. So that is just the essence of this video, to create awareness. Now let's talk about physical signs of infertility. Remember that I said that these signs of infertility in men could be obvious or they might not be obvious, okay? So I want to be aware of that. Now I want to divide these signs of infertility in men into three subparts. Yes, for better understanding. So we're going to start by talking about the signs of infertility in men, but we're looking at the physical signs first and foremost. And what I mean by that is that are just those signs that you can see, easily spot with your eyes. The man could notice it in himself, or his partner notice it in him. Okay, so the first sign we'll talk about is low sex drive or low libido, as people will call it. Now, what it simply means is that as a man, you would normally have urge for sexual activities frequently or regularly, but you notice that as time goes on, there is this decline in the urge for sexual intercourse or anything related to sex in the first place. This could be a sign of infertility in you. You should go and check yourself up. Another sign I want to talk about is the inability to maintain erection. Now, what I mean by that is that as a man, you realize that it is hard, or you find it difficult to keep or maintain erection firm enough for sexual activity to take place. Now, it is important to know that there are occasional issues that could happen, and it could be as a result of stress or tiredness that could trigger this. So the fact that you are finding it difficult to maintain erection doesn't automatically mean that it is infertility. Sometimes if you're tired as a man, or if you are stressed as a man, it could also affect sexual activity. But also another reason could be as a result of infertility, and it's important that you check it out, especially when you notice that it becomes persistent or it is frequent. It could be an underlying issue that you should check out. Another symptom or sign I want to talk about is the sign where you notice that you're experiencing pain or swelling or lump in the testicles. Yes, now you might ask, what exactly is the testicles? Now the testicles are just like two round organs that are located inside the sac beneath the penis, what people call the balls. Yes, the balls, right? So the testicles are located in the balls or in the sac beneath the penis. Now medically we call that sac the scrotum, right? But people can call it balls, whatever you call it. Those two sacs, the testicles are located in them. Now these testicles are very important because they are responsible for the production of sperm. They are responsible for spermatogenesis, so the production of sperm cells. They are very, very important for that purpose. Now, so if as a man you notice that there's pain, there's swelling or unusual lump in that area, it is not something that you should ignore, simply because it could affect sperm production, right? It could affect the process of producing your sperm. Another point I want to talk about is having very small or usually large testicles. Now, since I've already explained what testicles are, what you will notice is that there is a noticeable difference in the size especially if it seems that it is abnormally large. If you, well, those in the medical field, we are used to saying all that. So especially if you notice that, oh, it is abnormally large or it is unusually small, okay, this could be a sign that something is wrong, okay, with your testicles, and it could be linked to hormonal or sperm production issues. Don't and don't neglect it. Another point I want to talk about is having reduced facial hair or body hairs. Now, if as a man you notice that you have very little facial hair or body hair, that is in comparison to what is typical, to what you will normally find. If you notice that you're having reduced facial hair or reduced body hairs, it could be a sign of hormonal imbalance. And this hormonal imbalance could mean that the person has low testosterone level. Now, testosterone is simply a hormone that is important in the production of sperm. That hormone is also responsible for making your voice get deeper as a man. That hormone is also responsible for the body hairs that you have. Okay, so all those growth and development that you will normally experience during puberty, it is being triggered by the release of a hormone called testosterone. Now you can imagine what it means if that hormone is being affected. If that hormone is being affected, if it is abnormal or if there's imbalance in it, then it means the functions that hormone carries or triggers out is going to be affected, including sperm production. Okay, do you understand that? So it is very important that you go and check yourself. Another could be, and also I want you to note that if there's a disruption in this hormone during this stage in life, even at an early stage, it can go on to affect fertility later. Okay, it will go on to affect fertility later on in life. Now that we're done with that, let's go over to the next sign, the next sub sign of infertility. Let's talk about semen related signs. Let's talk about it now. The first question will be, what exactly is a semen? Semen is simply just that fluid that comes out, that thing that looks like water, but it's not water, can never be water, that is being released from the penis during ejaculation. Now, during sexual intercourse, ejaculation takes place and there's a substance that comes out. It's usually kind of whitish or cloudish in color or appearance. That is what is called the semen. Now, that is very important because inside that semen you have the sperm. Yes, so inside the semen you have the sperm in it, and the function of the sperm is to fertilize the egg in a woman, and pregnancy or conception takes place. So you see what I'm driving at. So now you see that it's important that you as a man, your semen has to be in the right balance. So if you notice that you have very low semen volume, the volume of your semen, that means the amount of the fluid that you release during ejaculation, it is noticeably small. I'm not saying that you should go and get measuring job now to start measuring whether your semen is adequate or inadequate. No, but ideally you are not to have few drops, like drops after ejaculation, or when you ejaculate you are not seeing like drops of semen. It shouldn't be. It should be at least how will I call it? It should be much enough in terms of volume. It should be much enough. It shouldn't be up to a bucket or up to a jug, but then it shouldn't be in form of droplets. I don't know if you understand what I'm saying. So now once you notice that it is consistently very little, emphasis is on consistently very little, then you have to ensure that you pay attention to it and see your doctor. Another sign, semen related sign of infertility is watery semen. Now normally the semen is usually thick or slightly cloudy or whitish in appearance, but if it appears to be watery, like it's now looking like plain water, but a colored plain water. Water has a certain consistency. I don't know how to explain it, but water is very liquidy. Do you understand? So if the consistency of the semen is now like plain water, that means there's something wrong. Yes, because it's supposed to have a certain thickness to it. Yes, it shouldn't be too thick, but it should have a certain thickness to it. That's how you, apart from the color, the consistency, is what you use to differentiate semen from any other thing. Okay, so now if you notice that it is watery, almost like plain water with little or no thickness, it could mean that there is possible low sperm count. But again, that doesn't mean that you have confirmed, that doesn't mean that you are a confirmed infertile man. No, it could be something else, or it could be nothing to worry about. Now, number 3 will be experiencing pain during ejaculation. Now, ejaculation is not supposed to be painful. Yes, so if a man experiences pain or discomfort or burning sensation during ejaculation, it could indicate that there is an underlying issue, such as maybe infection, which is usually very common, or it could be as a result of blockage in that region, and it should be checked out. Number 4 could be, which is usually not common, but it happens, is having no ejaculation at all. Yes. So as a man, you notice that after sexual intercourse or during sexual intercourse, there's no ejaculation. Nothing is coming out of you. It happens, but it's very rare. Every time. Every time. Now, what I mean by it's very rare, it could happen maybe this time during sexual activity, there's no ejaculation, but the next time there should be ejaculation. Not that consistently you're consistently not having ejaculation. You can imagine not having ejaculation, no semen, invariably meaning there's no sperm, invariably means you can't get a woman pregnant medically. Okay, so it's important that you check it out. It is rare, like I said, but it does happen to some men. So please check it out. It's possible that it could be as a result of blockage, okay, the region or the pathway through which the semen is supposed to pass and come out of the body is being blocked, or it could be a medical signal that this person is battling infertility issues. Now, let's talk about the next sub-sign, which would be the medical and lifestyle factors. Now, this is something that a lot of people ignore, and they are not exactly signs that you can see, but they are important clues. Now, number 1 would be having a history of mumps. Having a history of mumps, specifically after puberty. Now, for those who don't know what mumps is simply a viral infection, and the mumps usually affects regions like the jaw region or the cheek region in a man. I'm talking of in terms of a man. It affects jaw or cheek region generally, but then in a man, I'm trying to explain that it could affect the jaw region and the cheek region. And if this happens after puberty, which is what I want to emphasize, if it happens after puberty, it can sometimes affect the testicles and reduce sperm production. Yes, it can. Now, number 2 we'll talk about is having previous surgery in the testicular area. Now, what do I mean by testicular area? The testicle. I've explained what the testicle is. I've told you where the testicle is situated at. Now, if you've had surgeries before in the past, even when you were much younger, you've had surgery, maybe you were playing, you had an accident or whatever the case may be, and you've had surgery in that region, in the testicles or around the testicles, this could go to affect your fertility later on in life. That's just what it is. So you need to know that this is a kind of predisposing factor. It could predispose you to having or battling infertility later on in life. So please take note of that. Also, another is having undescended testicles in a child. I don't know if there are people who have come across this, but there are children that when they are born, ideally when a child is born, after a while the testicles, which is in the body, proceeds or moves down into the balls or into the scrotum or into the sac, anyone you want to call it. But there are male kids that it doesn't happen. Okay, and so you have to have surgery to be done to correct that, surgically to correct that. But it is also very possible that just because there has been a surgical intervention in that region, then fertility might be an issue later on in life. I want you to take note of that. Even if it has been corrected, fertility issues can come up later on in life. Now, let's talk about lifestyle factors that can increase your risk of having fertility issues. alcohol consumption. I've said it several times in this video that the taking of alcohol, smoking, those in the medical school, back then as a student, if you are asked in a question paper that mention predisposing factors of any condition, whatever condition you want to mention on it, or the condition on it, any disease, let's say it's a disease you've never heard of, these two factors are always predisposing factors, even if it's a disease you've never heard of before: smoking and alcohol consumption. It's just always there. It predisposes you to a lot of things, and it's short all that's a lot of things in terms of a lot of conditions, a lot of disease. So the same thing with this smoking, consumption of alcohol, heavy consumption of alcohol can predispose you to having infertility issues as a man. And I know that you will say that my father drank alcohol all his life, gave it to 100 children. My grandfather, we're very my brother. You don't know how your body will take it. That's the truth. Everyone's body is different. What could work for A might not work for B, even if it's the same lineage. That is why you see that cancer could run in a family, in a lineage. You have cancer in that family, and there are some members of the family that don't have cancer. It's not that they did anything special, they just don't have it. So that's how it is. The same thing. You don't know how your body will take it. Do not compare yourself with another person that you see that is taking in alcohol or taking or smoking consistently or frequently. Please just avoid it. Another thing could be constant heat. Now, constant heat is a very important factor because as a man, placing hot things on your thighs, because it's around the balls area, around the testicles invariably. So placing hot things, say for example you have a laptop, you're always working on your system, always in the hot environment, it is not good, because for sperm to be produced, the process of sperm production, we call it spermatogenesis. So for that process to take place, the body doesn't need a hot environment. Okay, it needs a slightly cooler environment. Yes, it does. So by the time you're always exposing yourself to hot environment, hot places, hot items like laptop over time on your lap, you are predisposing yourself to infertility. It is what it is. Another thing could be as a result of wearing a very tight undergarment. Now, if you are that kind of person that you like your undergarment as a man to be very tight and heated, remember, with putting on tight undergarments, you are trapping heat in your body. And I've already explained that heat and the production of sperm, they don't marry at all. So it's important that you wear loose fitted garments that let air be able to penetrate, let air be able to go into that region. Now let me state this clearly. This video, I have talked about different signs and symptoms, and also talked about risk factors or predisposing factors to having infertility as a man. It is not diagnosis. So you have to go to the hospital and get proper diagnosis first to confirm. You can't watch this video and confirm that yes, you have infertility or your husband has infertility. And I'm not putting out this video for you to blame any person or start assuming that, oh, this person has this symptom, so he's infertile and all of that. No, I'm here to create awareness. That's the essence of it. So go and check yourself, and check yourself early. And as a man, if you're noticing any of these signs, don't wait till you get married, because it's going to save you a long time of pressure, a long time of emotional stress and all of that when you attend to this issue now, even at your young age before you get married. And it shows that infertility is not a woman's issue. It's not even a man's issue. It's a couple's issue that both parties should address together by going to the hospital together to get treated. Now, I haven't said all this, we'll come to the end of this video, but I want to ask a question. Why is it that in the society we live in, when a couple are together and pregnancy is not forthcoming, the woman is the one most times expected to go to the hospital and get tested and treated? Why is that so? Let me know honestly in the comment section. Why? I want to know why. And also, if you're a man watching this video, if you have any of the signs of infertility, if you do, or just thinking out loud, if for example you have any of the signs of infertility, would you go and check yourself early? That is, you notice the signs, will you go and check yourself early in the hospital, or you wait till it becomes a big problem before you go and check yourself? Let me know in the comment section. Now, if this video has been helpful, let me know in the comment section. Also, don't forget to like the video, share, and subscribe to the channel. Please, there are people who you know would need this video, men, women alike. Please send it to them. And also, don't forget to make your recommendations on kind of content you love to see. And until I see you next time, bye, love, and God bless.